The government shutdown is finally over after a record-breaking 43 days. It's not a good record we wanted to see.
Right.
Yet the standoff over healthcare subsidies, that does continue on Capitol Hill.
Look, and we've all been watching prices go up, but the health insurance premiums for millions of Americans are going to see a major price hike. So buckle up and watch us.
We want to know who's going to pay more, right? So Nina Pineda is here with more on that. We were just talking about, we know personal people who are going to be impacted.
I was up in the Catskills over the weekend, met a retired couple. They said they pay about $6,500 for the two of them annually. Since the marketplace is open and you can take a peek, their premiums are going to $34,000. $34,000 from $6,500. So simply unaffordable for millions of Americans. The plan to reopen the government as it stands right now does not extend health care subsidies. Whether there's a stopgap put in place is still being debated, but according to a new poll, if the tax credits expire, an estimated 4 million people will become uninsured, and 24 million people will definitely see an increase in the cost of premiums. We're talking paying double, triple, quadruple.
Wow.
A new poll by KFF, which is a nonpartisan health policy research organization, showed a much higher than expected rise.
The amount people pay each month is likely going to double. On average, we're expecting that premium payments are going to rise by 114% next year if Congress doesn't extend these tax credits. Some people will no longer get a tax credit next year if these enhanced tax credits expire. So, most people will still get some financial help. They'll just get less financial help. Some people will lose it altogether, and it's likely that those folks might not be able to afford to keep their coverage at all.
So that is the fear, is healthy people leave the marketplace. Sicker people stay in. That's the risk pool. And then prices go up for both members and insurers, as well as hospitals, who by law, they have to treat patients showing up without health care. Their job is to stabilize. Then these hospitals go into debt because they've spent that money as well.
Okay, so that's so real.
Wow.
What you're saying is millions of Americans could just drop their health insurance. No health insurance at all. So if they're shopping the open marketplace, what are their options?
You have to pay attention, especially right now. This situation is still fluid. So follow what's happening in the news and start looking at your plan, because if you're auto-enrolled, you can just get re-enrolled in that current plan. And that may not work for you right now with these subsidies in question. So what worked for your family before may not work now. We spoke to a healthcare insurance expert with Lending Tree. His recommendation, do not drop altogether. Here's Talon Abernathy's advice on switching plans for your family.
Shop for a bronze plan. Now here's why. Starting in 2026, all bronze plans will be high deductible health plans. What that means is you can open a health savings account or an HSA.
With an HSA or health savings account, there's triple tax advantages. You'll pay no taxes on contributions, no taxes on investments while they grow in the HSA, and no taxes when you withdraw to pay for health expenses. A family of 4 in New York would save about $500 a month to make the switch. And when shopping on the ACA marketplace, Talon says steer clear from tempting catastrophic healthcare plans.
Although catastrophic plans have very low premiums, you will pay a lot of money before most of your coverage kicks in, and catastrophic plans are not eligible for subsidies.
Before choosing, look at ACA star ratings. These measure quality, satisfaction, and access to providers.
It's important to remember, just because you're healthy doesn't mean you can go without health insurance.
It's an impossible choice. Some people may be getting text messages and emails now because the marketplace is open. So how long do people have to choose their plan?
The very important deadline is December 15th. Open enrollment started November 1st, but you need to try to lock in that plan by the 15th, because then your coverage will automatically start on January 1st. If you buy your plan after the middle of December, there's going to be a little gap there. So the coverage then will start in February. So it's a good idea. We don't know what's about to happen. The bill has passed the Senate. Congress is still debating. Let's see if they put something in that may help people. But if they don't, you're going to have to really pay attention to your plans and pick something that you can afford for your family.
Wow, that was just
not easy
eye-opening.
choices.
The fact that I spoke to a couple that pays $6,500 a year, and that's going up to $34,000.
It's a lot.
Unacceptable.
They can't be the only ones, too.
Which is why this is the centerpiece of this debate and ended up in the longest government shutdown in our history.